Welcome to ALH 3, Chapter 31, Misuse, Abuse, and Addictive Drugs lecture. Today we're going to look at our learning objectives, which are discussing dangers of drug abuse, recognizing medications used for treatment of alcohol abuse, discussing illegal abused drugs and their effects, identifying misuse or abused prescription medications, describing ways that lead to misuse or abuse of prescription, non-prescription medications, and identifying possible abuse, misuse situations, as well as describing actions leading to misuse or abuse of prescription and non-prescription medications, and identifying possible misuse and abuse. Providing patient compliance with medication used to treat disease and conditions and the misuse, abuse, and addiction to drugs. And this patient education is key because we want to make sure, again, that they don't feel that they are being judged or that they're being misunderstood, because if that happens, they'll immediately put that communication block up. So drug abuse. Abuse involves using a drug in a way that is inconsistent with medical, cultural, and social norms. It includes prescribed or over-the-counter medications and street drugs. Drug misuse is defined as non-specific or indiscriminate use of drugs, which in comparison, drug abuse refers to the improper or excessive use. Allied health professionals are prone to drug abuse because of the availability of drugs in the healthcare setting. And so it's important to be aware of that for your peers and for yourself. Drug abuse and misuse, common signs and symptoms. We'll see changes in weight and sleep habits, impaired memory, illogical thinking, mood swings, irritability, depression, and anger, defensiveness, anxiety, and overreactions, to difficult situations, changes in vital signs. Often you'll see runny nose, nasal stuffiness, bloodshot eyes, and sweating as symptoms, and changes in appearance. So if you're looking at a coworker or a peer or a friend or a family member, if their appearance starts to change, they don't appear to upkeep themselves and have their normal habits, you want to start looking and seeing if you might see some of these signs and symptoms. Also, drowsiness, constipation, hallucinations, lightheadedness, dizziness, headache, impotence, cardiac arrhythmias, nausea, sore mouth and throat, diarrhea, respiratory distress, arrhythmias, local edema, rashes, mental confusion, weakness, hypertension, tachycardia. These are more common signs and symptoms, and as you can see, there are quite a few, and none of them are very comfortable. And so you can see that when there's drug misuse and abuse, that even though these things are happening and these signs and symptoms are not good, the want or need for that drug overtakes the really understanding that these things are happening because of the drug misuse and abuse. And therefore, a lot of times you will see patients that are, or friends or family members again, that are misusing or abusing drugs and alcohol, and they constantly are not feeling well, and they're constantly having multiple things, but they don't make the connection again to their misuse and abuse of drugs. So here are some factors that contribute to drug abuse and misuse. There's a desirable feeling for some following the drug use. Sometimes a person might have curiosity, or they might be pressured into it by their peer, There are physical, psychological dependencies that occur, and it's important to note with some drugs, it can be trying that drug one time and they are physically and psychologically dependent on it. It also has to do with drug availability, vulnerability of person to the drugs, escape from or self-treatment of emotional disorders or mental health disorders, genetics, especially we see genetics come into play in alcoholism. And also another factor contributing is social status and the need and want for acceptance in your social status. Drugs of self-medication are often the most abused or misused because of chronic use and excessive dosages, with curiosity being one of the leading reasons for beginning drug use. These abused and misused drugs include nicotine, alcohol, opiates, amphetamines, which are uppers or speed, barbiturates, benzodiazepines, which are downers or they're used as an anti-anxiety drug, which you've already studied, cocaine, marijuana, hallucinogens and psychedelics, inhalants, and anabolic steroids. In addition to these drugs, what do you think are the most frequently abused chemical substances? And they might be listed on here, but they're not because it's legal. Xanthins and caffeine. And where are these drugs found? So we find these in coffee, tea, colas, and chocolate. And the effects are mild stimulation and euphoria. Nicotine. Nicotine is a carcinogenic. It increases alertness, facilitates memory, improves cognitive function, and suppresses appetite. Causes tolerance and physical dependence, and few people achieve long-term success when attempting to quit smoking. This is a very difficult thing. In attempting to quit, there are three nicotine therapy replacement forms. There's patches, chewing gum, and nasal sprays. What happens during nicotine withdrawal? Well, the patient may experience cravings, nervousness, restlessness, irritability, impatience, hostility, insomnia, increased appetite, weight gain, and impaired concentration. Have you ever witnessed this in a family or a family member or friend that is really trying to quit smoking? I have, and I've seen many and all of these things happen when they are going through withdrawal. Look at alcohol. Alcoholism is the third most serious public health problem following heart disease and cancer. Think about that for a minute. Alcoholism is the third most serious public health, and it's behind heart disease and cancer. Alcoholism increases blood pressure, it depresses respirations, it may cause hepatitis, cirrhosis of the liver, and erosive gastritis. Chronic alcohol use produces a tolerance to alcohol, and this means that the more you are chronically using and abusing alcohol, the more tolerance you have, so then the more alcohol you need in order to get to that same state that you're seeking. Anti-abuse is given to alcoholics to assist in alcohol avoidance, and we've seen in study upon study that alcoholism tends to be within families. Alcohol is one of the oldest and most abused drugs in the United States. And the physical effects of chronic alcohol use are atrophy of the cerebrum and loss of intellectual function. So it's really affecting our brains. Look at opiates and opioids. Morphine, Oxycontin, meperidine, and hydromorphone are included in these. These drugs produce mental depression. Abusers like their feeling of well-being and euphoria, and methadone is used in withdrawal programs. Narcan is used with overdoses of opiates and opioids. What are these drugs commonly used as? They're commonly used as pain relievers. Amphetamines and cocaine. Amphetamines are also called uppers or speed and have both legal and illegal uses. Amphetamines are used legally to treat chronic fatigue, narcolepsy, and ADHD, as well as mental depression. Amphetamines, cocaine, are a stimulant of the central nervous system. They increase physical performance, psychological stimulus. They cause feelings of alertness, confidence, talkativeness. They create feelings of euphoria and a sense of arousal. A person typically increases drug use as the tolerance occurs, and this addiction is difficult to treat. Central nervous system depressants, barbiturates, and benzodiazepines, that is Valium, Xanax, Ativan. They're commonly abused due to the use for anxiety relief. The tolerance may lead to physical dependence, and withdrawal needs to be gradual with this. The therapeutic uses of benzodiazepines and barbiturates should be short-term, because if they are not, they become addictive, and then we get into the misuse and abuse of the drug. Marijuana. Marijuana causes sedation, euphoria, and sometimes hallucinations. It's absorbed by fatty body tissues, leading to prolonged drug effects. It decreases sperm counts, testosterone, estrogen, menstrual cycles, and ovulation. It can cross the placenta, causing a teratogenic effect. The effect of this can be lowered birth weight, and it does create a tolerance. Marijuana is considered to be a central nervous system depressant. 3 effects of marijuana use could be euphoria with gaiety and heightened sense of humor, sedation with lethargy and memory loss, and sometimes you can, again, as mentioned earlier, have hallucinations with marijuana. Hallucinogens, psychedelics, and psychomimetics. These produce auditory visual hallucinations due to increased awareness of sensory stimuli. These include LSD and mescaline. Mescaline is made from flower heads of peyote cactus. Other drugs in this category are psilocybin, which is produced from Mexican mushrooms, ecstasy, which is derived from amphetamines, and PCP, also known as angel dust. PCP creates dangerous, unpredictable responses, including rapid emotional changes. Inhalants. Inhalants are popular with young children and teens. They are huffed or sniffed by the abuser. They create euphoria and hallucinations. They're found in cleaning products, glue, hairspray, lacquers, and paints. These lead to confusion, coma, brain, heart, lung, kidney, liver, and bone marrow damage, and as well as death. It's important that we educate our younger children and teens on the effects and the side effects, and that they can cause permanent brain damage as well as death. Anabolic steroids, these are used by athletes to enhance athletic performance and increase strength and body weight. They are prepared from testosterone, and they tend to masculinize the user so that they become more masculine. The adverse effects are hypercalcemia, edema, liver impairment, insomnia, nausea, vomiting, anorexia, stomach pains, unusual hair growth, and male-type baldness. Do you know any famous athletes who've been using or have been accused of using anabolic steroids? And maybe possibly Olympians? The effects and females we see a decrease in breast size, a decrease in ovulation and lactation, as well as menstruation. And in males, we see an increase in breast size,